Well, it's interesting that we have ADHD Awareness Month. Certainly in my clinical experience over the last few years, awareness around ADHD has grown. There are still some myths about ADHD, the idea that it isn't a real condition. I emphasize the word condition. It's not a disease or an illness. Its very nature is that it's a neurodevelopmental disorder, but that just recognizes the fact that everybody has wiring in their brain, and for some people they have the challenges that we associate with ADHD. One of the key aspects of the neurodevelopmental nature of ADHD is that it's something that by definition should arise towards the end of one's childhood or early adolescence. So usually we would look for the symptoms to be present below the age of 12. There may be a few exceptions to the rule, but generally that's when it should first appear. Awareness about ADHD is growing. So as an adult psychiatrist, I see people aged 18 plus, some of whom may have been treated for ADHD in their childhood, and for a variety of reasons they may have been on treatment, come off it and want to go back on. But the vast bulk of people I see have never been diagnosed with ADHD. So ADHD is the same condition, and it would have arisen in that person's childhood. But what we do see is some differences in how it maybe manifests as one gets older. So we've established that the two main symptom clusters are inattention and hyperactivity and impulsivity. Generally speaking, but not always, the hyperactivity and impulsivity may draw more attention. So for example, from teachers or parents, because if someone isn't sitting still in a classroom, that's the sort of thing that might get them in trouble, may be noticed. Having said that, distractibility is often a key component as well. What we do tend to find is that as people go through their teenage years into their adult life, the hyperactivity and impulsivity in a large proportion of people does start to fade out. So for adults who haven't previously been diagnosed, it might be the difficulties they have with concentration, with organization, with prioritizing tasks, that really brings them to the attention of medical professionals.